Hello, everyone, and a warm welcome to this webinar about scaling and combining digital innovations in healthcare. My name is Anne Essen. I'm an associate professor at House of Innovation at Stockholm School of Economics, and I've been devoting a lot of years to researching digital innovations in healthcare together with colleagues. And I think one theme that has been really striking is the great amount of creative ideas and innovations within the formal healthcare system, as well as from outside of the healthcare system in terms of not least the growing health tech sector today from private actors who want to also contribute with new innovations to healthcare. And I think also among students at Stockholm School of Economics, we see an increasing interest in developing and contributing to an improved healthcare system. It's really growing. So the problem, as we see it, is not the lack of innovation or creative ideas tied to how we can improve healthcare, but rather what seems to be lacking is a structure and arrangements enabling all these innovations to be integrated and combined, structures enabling them to be found and understood and evaluated in order for them to be combined in sort of a coherent whole that can be presented in a somewhat coherent fashion to the end consumer. So today we're going to talk about scaling and combining innovations in healthcare, and we have two panels. One panel with entrepreneurs from within and outside of healthcare who have been successful in introducing and getting their innovations found and integrated into the delivery of healthcare and into patient self-care. And then we have another panel with policymakers at organizational and national level who will talk about their efforts to facilitate the identification and combination of innovations. But first, I have the great pleasure of inviting Petra Norebach, Secretary of State at the Ministry of Health and Social Affairs, up on stage. And you will talk about the government's perspective on these things. Warm welcome, Petra.
Thank you so much for having me and letting me be part of this seminar. I'm very happy that you arranged the seminar and that we get to talk about these very important issues. And it's with great pleasure, of course, that I take part in today's discussion of how we can facilitate innovation and the spreading of innovations within healthcare. Sweden has, as you know, a strong tradition of prominent innovations and high-quality research within the life science field, a tradition that extends from award-winning discoveries to groundbreaking medical breakthroughs. Innovation is vital for our future, and I'm proud that Sweden is ranked among the top innovation countries. Innovation drives progress, opens new horizons, improves the quality of life for people, and has the potential of finding solutions to today's and tomorrow's significant health and societal challenges. And as you all know, we face challenges like never before, where resource constraints, increasing healthcare needs, and technological advancements require us to think anew and creatively. And in recent years, we've seen a big increase in new technology being used in healthcare, which is good. From mobile applications to wearables, from telemedicine platforms to AI diagnostics. And these innovations hold the potential of revolutionizing patient care, improving outcomes, and improve the efficiency of our healthcare system. But one challenge remains, and that's what we will discuss today: scaling and combining these innovations into a cohesive and effective healthcare ecosystem, and at the same time, ensuring equal adoption and usage across the country and between patients, which is a real problem today. The fact that our world is becoming more data-driven can lead to new important and crucial knowledge and innovations for future healthcare. but the true potential lies in their integration into broader healthcare systems, where they can complement existing practices, streamline workflows, and deliver comprehensive care to patients. Successful implementation of digital innovations in healthcare requires a multidisciplinary approach. By building strong partnerships between policymakers, healthcare providers, technology developers, researchers, and other stakeholders, like we do here today, we believe that we can bridge the gap between research and market and thereby accelerating the transfer of innovations from lab to reality. And just to say a few words about what the government is doing in this field, we are committed to creating conditions where innovators can thrive, ideas can flourish, and the results of their work can benefit as many people as possible. And as we explore the challenges and opportunities of scaling and combining digital innovation in healthcare, one key component appears: health data and the underlying infrastructure for this data. Interoperable health data and robust data infrastructure is essential for digital innovations to deliver if they are supposed to deliver meaningful insights and personalized care, which is the goal. The use of data analytics and AI has the potential of gaining deeper insights into patient populations, identify trends, and tailor interventions to individual needs, and therefore, and hence increasing the overall well-being in our society. So this is a real opportunity. And the government has therefore initiated a reform of the digital infrastructure in healthcare, recognizing the need for increased national level responsibility in this field. The aim is to ensure that health data is accessible throughout the entire healthcare continuum, facilitating innovation while prioritizing patient safety. And a few examples. We have initiated several official reports to assist us in this work, such as the secondary use of health data, infrastructure for health data as a national interest, and improving conditions for monitoring health care. We have also tasked the Swedish e-health agency, whom you will hear from later on in this seminar. They are tasked with developing a proposal for a roadmap for a national digital infrastructure for healthcare, investigating and preparing the establishment of a technical infrastructure for patient data index, and preparing for a national function for interoperability. And additionally, one more thing that I want to mention that we have done, we have appointed a national coordinator for health data, Thomas Werngren, who will assist us in this important work, and not least in the implementation of the findings that the e-health agency and the official reports come with. So the aim here is to get away from a fragmented and suboptimal system when it comes to health data infrastructure. And we need to do this in several ways. And we need to create interoperability when it comes to legal, technical, semantic, and digital aspects. And what's the goal? What's the aim of this? Well, I think we need to talk about the patient, and we need to talk about the healthcare professionals, because it all comes down to that we need to save time for the medical staff. Instead of putting the same data, the same information into a lot of different systems, they could be spending more time with the patient. And it also is, of course, to ensure that the best healthcare possible is given to the patient. The government has also invested resources in supporting research and development in healthcare through the work conducted by Genomic Medicine Sweden, GMS. I think most of you know about this, which focuses on implementation of personalized diagnostics and therapies in healthcare. As a result, the implementation of whole genome sequences as standard of care has now been initiated in the Swedish healthcare. And even though tailored solutions like this has high initial costs, society will save money from not having to guess and try out different treatments before finding the right one. By continuing investing in cutting-edge research and technology such as GMS, we can create opportunities for new discoveries and innovations in healthcare. So to summarize, the real challenge doesn't necessarily lie in creating new ideas, but in getting them to reach those who need them the most, even though we need new ideas as well. We must ensure that innovations do not remain theoretical concepts, but become a reality for people in their everyday lives. Thank you.
Thank you very much, Petra. And very interesting to hear about your initiatives. And I think there may even be people engaged in the reform of the national infrastructure, the digital infrastructure in the audience as well, who may pose additional questions. I think what you're saying is that there will be changes in the national digital infrastructure, which are very much requested from what I hear and from what I've seen, right? And that's very nice. And I think today we can learn about how innovations have been able to spread and combine within today's infrastructure, and that can hopefully feed into the future efforts. So thank you very much. With that, I would like to invite the panelists, the first panel. And in the audience, if you have questions and comments, you're free to write in the chat as well as we speak. I will pick them up maybe later, but feel free to write the comments and questions while you have them in your head, so you don't forget them. Yes, so the first panel consists of a set of entrepreneurs, I would say. We have Sofia Ernestam. You're the Chief Medical Officer at Capio right now, but you've been involved in innovations such as the Swedish Rheumatology Registry. You've been involved in the development of PEP, Patientens egen provtagning, and Alltid öppet, apps that allow patients to test themselves, apps allowing patients and providers to communicate. For instance, we also have Anna-Karin Ekstedt-Bonamy from Doctrine. You have been, well, you are still the founder and engaged in Doctrine, a platform allowing and facilitating a smooth and efficient patient journey and a lot of data management functions. You can add to this description later. We have Andreas Ringman Uggla, who has been at Platform 24, another digital health platform, but now you are sort of having an external perspective, one could say, at an investment firm. Serendipity Partners, sorry, I had to just look it up again. Yes, and that would be very interesting to hear your view as an investor of these tech startups and how they are able to scale and be found by healthcare. Finally, we have Andreas Hager, innovation lawyer and also founder of Genia, an app allowing patients to manage their health and also communicate and share their data with stakeholders of different sorts. In short, warm welcome. And I would like to start, I think, by asking you, Sofia Ernestam, if you think about the digital innovations you've been involved in developing and introducing and spreading, how would you say that the scaling journey has evolved and what relationships have been important in that journey? And before I leave the word to you, we talk about scaling, and scaling can be defined in different ways. You can grow in terms of your number of employees, or you can grow in terms of your market share. I think today we can talk about scaling in terms of growing in number of users within a clinic, within the region, nationally, or even internationally. But how would you describe the scaling journey if you pick perhaps one of the innovations you have worked with, Sofia?
Yeah, so thank you for inviting me. So I have thought, when I thought about it, I have chosen to just talk a bit about the patient's own blood sample handling, PEP. patientens provhantering, because that's, I think there is a couple of key issues there. That was an idea actually with a friend of mine, so I think that's one point. It's so often about relations when you start thinking about innovation, and we started trying to have this in Region Stockholm, and invited some people working with blood samples, and we advanced this and actually launched it as well for patients with rheumatic diseases, that they could actually make their own referrals for blood samples. But it didn't fly actually. So it was not really a success, because the need from the patients was not any longer there, because we went from an healthcare where we took a lot of blood samples to not taking them so often and longer. So the need was changed. But instead there was another person in oncology, in children's oncology, that she saw this and said, oh, that would be perfect for our setting with children with cancer, and the parents, they wanted to see their blood samples. And so it went on, and someone else took it further. That was fantastic. And then we also had a contact with one person, Daniel Forslund, who actually said, oh, but this is a good idea. We need to put it up in ERA, so have it as a national service. And that was also some kind of relation, and that he saw something. And then it was launched to ERA, and when the pandemic started, all regions could use this service to have the COVID-19 blood samples that we all were taking, or in the nose, and we all could make our own referrals. So then it was spread, because there was a need. So you need to have a need from patients and from healthcare professionals, and not only nice to have, you need to have actually this sense of urgency to have this spread. So I think you need to kind of have someone to lift it to make it easy to spread, and also for other regions to pick it up.
Thank
So
you.
I stop there. Yeah.
Yes, thank you very much. And so you're saying that a function became relevant and meaningful in contexts that you hadn't even expected right from the beginning. But you had this function, and it was sort of found and understood by a set of different actors. And that's fantastic. So what about your innovation, or the way that you spoke about it, or that others spoke about it, made it easy to understand for these new stakeholders, do you think?
Very early, we did interviews with the patients and with the healthcare professionals, and tried to use the storytelling about how this actually changed their view of the disease. And in those days, you couldn't read your EMR yourself. So it was really, they were so curious about these blood sample results. So we had this story about how patients were really happy about having these results themselves, and that they could take control of their disease, and much more. So I think that was really important to have this iterative, agile way of working, where we just don't, we did some research, but I think that was also important, but to have this story about the need and how happy the patients were.
Thank you. Yes, and just a final follow-up. So who told these stories then?
The patients, and also, well, we presented the results, and also researchers, of course. But then when you should be really happy is when someone else is telling this story as their own story. And then you shouldn't be kind of jealous and think, okay, this was success in oncology. but you should be really, really happy that it's going further, and someone else is telling the story in maybe a slightly different way, then the spread is there, and then you should be very happy.
Thank you very much, Sophia. Yes, and that's a point we've talked about over the years, that sometimes you maybe need to take a step back and not be so keen at taking the cred for your innovation, but allow others to take the cred. That's how it gets spread. Thank you. And Anna-Karin, if you think about Doctrine and Doctrine's growth and scaling, because you're sort of, I don't know if you're an outsider or an insider, but you can reflect on that yourself. But what kind of evidence has been important for you in telling the story about your innovation, do you think?
Thank you so much for having us. And just a small correction, I'm not one of the founders, but I joined the company early on, about 7 years ago. And I think that the founders were the ones who actually found the problem to solve. Because I think that when you are about to innovate, you need to define the problem that you're solving really well. And the problem to solve for us is a bold one. It's the resource constraints in healthcare. And we aim to solve those by increasing the productivity and at the same time increase accessibility and patient satisfaction without compromising the working environment for staff. So that is kind of our problem to solve. And am I an insider or an outsider? I really like that question, because when you invited me to this seminar, that was one of the questions I asked myself, because I have a very long background in healthcare. I was a senior consultant in pediatrics at first Karolinska and then Saxiska Barnsjukhuset here in Stockholm, worked for almost 20 years in total in healthcare, and also had academic research, still have at the Karolinska Institute, where I'm an associate professor, having worked a lot with health data. So in some sense, I am an insider, and I struggled quite hard, I think, over the years to try to change the healthcare system from within by kind of fixing one after the other, like the inefficiencies from the inside. But then I turned 40 and got frustrated by the pace, because I found it much too slow to change it from the inside. So I joined a tech company to try to help the healthcare system from the outside. So that's my story. Back to your question about the evidence. I think for us as a company, it's crucial if we picked our problem to solve, which is like helping resource constraints in healthcare by digitalizing the patient journey in a smart way. It's really important for us, when we look at the evidence, to measure that we are truly successful. Because to us, it would be a true nightmare to launch a solution that makes healthcare worse than it is. I mean, we need to show evidence of improvement in the areas of productivity, accessibility, patient and staff satisfaction. That's really key to us. Otherwise, we are not successful, and we do not become credible in the commercial world, I would say.
Thank you. And just if I can comment on the first point, I hear that story a lot. I couldn't change healthcare from within, so I went to an external firm. And then when I'm in this external firm, then I have such great troubles getting in and helping the formal healthcare system. That's one story that we hear a lot, and that's also part of the background of this seminar, I think. So these meetings are important, I think, and I think the communication and the stories we tell are part of that border. But so you say evidence, and how can you give an example of how you've produced this evidence and how it was understood? Because that's very challenging. How do you prove that you...
Yes, it's very challenging. And I think that the most challenging part is that for us as a company, we only have one piece of the puzzle, while many of the outcomes that we would like to measure are with the patient themselves or with the healthcare providers, our customers. So we have been successful in establishing collaborations in the plural with our customers to start with, to be able to measure outcomes such as productivity, where we do not aim for solving only like the digital productivity, because if you are about to fix the healthcare system's problems, you need to look at productivity as a whole. You need to look at patient satisfaction, work environment, like in a holistic perspective and not only like in the digital platform. So collaboration is key. The other area where I think that we have been successful without actually seeking to be is that we have attracted a lot of independent academic researchers that have studied implementations of the doctrine platform, quite often from a work environment perspective and sometimes from a medical perspective, without us even being involved or knowing about it. It's like true independent academic research. And I don't really know how that happened, but I think that to us it is extremely important that we get independent, unbiased, non-commercial research that actually shows that what we are doing works.
Yes, thank you. And that's also something we hear from others. We shouldn't produce the reports and provide the evidence, but if you get a third party to produce evidence that helps people understand your innovation, then it's easier for people to trust that evidence. Final question, do you think the requirements on the type of evidence from you as a private actor is different from innovations coming from, for instance, from within a clinic, so to speak?
I would say that the regulatory landscape puts higher demands on us as a commercial actor because we sell this on the market, on the European market to start with, which means that we cannot say that we only work according to certain processes. We actually need to be audited on those processes and get the external certifications needed to sell the product on the market, while an innovation from within the healthcare system, such as a regional development of an app or a platform, for them, it's sufficient to say that they follow the guidelines. They do not have to be audited on the standards. So I think that requirements are higher on commercial actors than on public actors working with innovation, I would say.
Thank you very much. So let's turn to Andreas Hager. Sorry, I don't know what's with my labels today. You have been engaged in scaling and innovation, I would say, in a patient community. And I think you have also a rather unique experience of trying to scale your innovation abroad as well. I mean, in this group, there are more, but that's not too common in Sweden. So what do you say, Andreas, about the scaling process and the kinds of evidence and stories you need to tell to different kinds of stakeholders, from your view?
Well, first of all, I love hearing Sophia tell the story about PEP, and because I was in the room when she was, and sometimes when she was meeting her friend, and to see how things grow. And we also hear Anna-Karin talking about the founders and the founders' ideas. And I've also, when Andreas, the Platform 24 started, I was also in those rooms. So over the years, the kind of the source of the entrepreneurial impulse and this kind of great conviction that you have to go out and do something, and that's I think unites everything. And in my case, it was also about being part of a community and about, the future of my children, that also made it kind of without question something that I can devote my life to. And why is this so important to have this entrepreneurial impulse as a basis? Well, I think we also hear from Sophia and Anna-Karin about if it were only technical challenges, if we were only creating a good system, but it's not. It's about adaptive challenges, right? It's about, and even Petra talked about it. We talk about societal challenges today, but we're thinking about the societal challenges of tomorrow. So we need to find ways to adapt, both as we develop whatever solution, health tech ideas, and then as healthcare develops and research develops, as evidence develops. So I think that has been, for me, always the most important thing, to kind of stay true to my entrepreneurial impulse, but then find ways to engage in a learning community where we can work together, healthcare providers, the end users, the researchers, and I think that has been a big key. And there, in my case, since I work in rare disease, I have to go and work globally because, you know, the community in every country is too small. So it's been very natural to work globally from the start. But you were asking, sorry, what was your question, Anna?
No, I think you answered it. Can I ask you, when you say you need to go globally, so how do you do it? If you try to be concrete, can you give an example of how you've reached out to another country? I know we have startups in the audience and they wonder, how could I do this? So can you give them any advice regarding how to spread out, branch out from Sweden?
Well, first of all, Sweden is always very interesting for everyone because of our history and how we, especially in health tech, how we use and work with data. We're a super interesting environment for testing and doing stuff. So I think we have a good reputation and it's easy to reach out and get meetings. But going from there, I think what I try to do always is to listen to what people are interested in and then go back to where I am with the shoulders to the rail and do stuff, and then go back and say, okay, you were talking about these things, we're thinking about it this way. And then very early on you are able to attract research funds. You find entrepreneurs in other countries, maybe clinical entrepreneurs that want to do things and test things, and you build from there. I mean, it's about the relationships, a lot about that. And then, of course, understanding, in my case, my impulse was, yes, my kids have a disease, my kids have to go through super tough treatments. Those are connected to a lot of suffering, but there is a lot of suffering around communication, missed opportunities, how we as patients are treated in healthcare, how we as patients can engage in changing healthcare in the adaptive challenges that we're facing. So for me, it was finding an international community that was also interested in the same problems, information sharing, relationship building, patient-driven innovation, those types of things. So you need to find your own community, I think,
Yes.
everything is global nowadays. So.
Thank you very much. Yes, and yeah, it's a good advice to listen and find your community, definitely, and then from there you can build and really try to understand how your piece fits in with another context. Thank you. And Andreas Ringman.
Yeah, sorry,
yeah.
I should just add that
Yes.
I'm employed at the Karolinska University Hospital to try and spread this knowledge from within the system. So please reach out, and we're here to support startups and innovative companies and trying to create a regional ecosystem to promote good new companies.
Great. Thank you. And Andreas Ringman, Ugla, from your view, I think I will ask you an open question. What do you think is important to talk about when we talk about scaling digital innovations in healthcare, based on what you've heard?
Yeah, thank you, Anna, for inviting me. I think so. I will try to take a perspective both from having kicked off and run Platform 24 for quite a few years, and also now as being on the other side, so trying to help new startups get funding and then grow. I think very early on, I think there are at least two challenges and two contradictions here in how you scale a software company, because now we're talking about software, which is fundamentally different from a company which is perhaps based on a hardware solution. And I think first and foremost, we, at least in our team, internally discussed a lot what is actually the innovation piece here and what is not the innovation piece. because scaling innovation by definition and by design takes time. And I think to some extent should take time in healthcare because there are these hurdles and they make sense in many ways. Especially from a patient safety perspective and regulatory perspective. It is the way it should be, I think. And however, some aspects of digitalization of healthcare are not innovation as such. And they do not then adhere to the same rules of being slow as other components. So the way that we thought about our product at Platform 24 very early is a healthcare delivery logistics platform. So we asked ourselves, how is healthcare being delivered today? It is being delivered by a man-made system where we talk about primary care, secondary care, we talk about clinics, we talk about primary care centers, doctors, nurses. None of this is a given. There is no natural law here. It is just the way it has developed over the years. And we were asking ourselves, how would a digital first delivery system look like, where the initial transaction, if you like, or the service offering is delivered primarily digitally, which will then, of course, be a mixed, as we usually call it, digi-physical delivery model, like digi-fysisk. So how does that look like? What are the components? And that in itself is necessarily not an innovation. It is more of a railway that you put carriages on top of that, and you make sure that a majority of your healthcare interaction can be digital when that's possible. And we know approximately today what can be digital. And that's being pushed continuously further. And that takes us to the scalability part. As a software company, there is an inherent challenge and conflict in between not being too customizable for each customer, but being enough so that each customer can actually use the software. Because if you do 100% customization to each customer, you become an IT consultancy firm. And if you're doing zero customization to a customer, you become obsolete. So the question is, where do you find your balance here? And that is very hard because Platform 24 today delivers to 19 or 21 Swedish healthcare regions, and they all have different views. We deliver to national systems like Inera. We also deliver to many hospitals across 5 other European countries. And still, it's one code base, it's one software solution. How do you do that? And I would love to be able to say it was easy and we know exactly how to do that and we have all the answers. No, of course not. But we had to make quite a few hard prioritizations on what is what and what do we allow and what don't we allow. And over time, that creates scalability. And then you can ask yourself, but why would that be good for one individual region? That sounds like it's good for you as a company, but not for you as a region. But it is actually good because what happens here is that you can learn from each other. So it's not necessarily the way you do it in region 1 is necessarily the best way, because apparently there are 20 other regions, if you only take the Swedish system, who are also doing lots of good stuff. And either we say that all of them are right or all of them are wrong, and the truth is somewhere in the middle, right? There are good ideas here and there. Same thing when you go to Europe. But at the end of the day, you cannot build a customizable platform that is cost efficient. It will be too expensive. And it will also be too unstable, because what we can offer all of our clients is a very stable solution, because we have hundreds of thousands of interactions each day on the platform. And that, of course, demands quite a lot. And there's no other way to scale than to be very strict about safety, stability, and how it's being used. Then you can't have 21 different copies, if you like, of one solution. So that's, I think, one thing that one has to remember. And it's really hard, because you sit in meetings and there are good arguments for why we should tweak this and why X, Y, and Z should just be a little bit different in this region or in that Dutch hospital or that German clinic. But then you have to take a deep breath and try to explain why it actually makes sense to keep it the same.
Thank you very much. And because we've been talking about this, that the regions could serve as test beds in Sweden, and now, well, an organization could be a test bed as well for further spreading the innovation. Karolinska could be a test bed for hospitals in Sweden. What do you think is necessary to make it easier to see regions as test beds and use them as test beds or hospitals?
Yeah, that's a question we've been thinking about a lot as well. And I think maybe the first question you should try to ask yourself is what needs a test bed and what is ready for broad rollout. And in my world, we don't need test beds to do digital consultations on video or text-based chat or sending, filling out medical questionnaires. It's been done 1,000 times, and in so many countries, including Sweden, there's just no need for test bedding here or pilots, etc. It just hinders what we already know works really well. So I would remove that, and I would use the test beds for really complex and new things. So specific protocols for disease X, or trying to figure out how a new digital tool can be used for condition A, B, and C. I think that's where a hospital, for instance, can really be beneficial. I do not think it can be beneficial for a healthcare solution or software solution that should benefit the millions, because I think that's where we are at. In my world, there is no real reason for why first connection to healthcare, if that's what suits them. And if what suits them is more of a physical experience, then that's what we should deliver. But fundamentally, these are not new things, and they are very ready to be rolled out at a broader scale.
Thanks very much. Sofia?
So I agree with Andreas, and I also think that the region needs to work much more close, both to the national level and to the where the healthcare professionals with innovation ideas work, and also work with the legal issues. And but I think the testbed question is also interesting. I think the testbeds are still needed for when you start from the patient perspective. For example, elderly care, how could it actually, with all these complex questions, be designed from the patient's perspective? So I think there you have still a lot of need to actually address the needs from that patient, the individual patient with its relatives, and there I think still you need test beds.
Yes, and Andreas wants to comment.
Yeah, I maybe have a question back to Andreas. It seems like you're talking about whether the environment should adapt to what you're proposing, or whether you should adapt to, and it goes both ways. In interoperability, we heard that it's about the legal, the technical, the semantic, organizational, all of those things that need to adapt in some way. So since you have been able to scale in the Swedish environment, and I know this is a big challenge for everyone that engage in this world, it's kind of, okay, we have a great idea that on the surface is easy for everyone to plug in, but then behind the scene, there are so many things that need to adapt, or we need to adapt to, and kind of drive interoperability in different aspects. So how have you been thinking about this, and how have you contributed or worked around that kind of behind the scenes type of adaptation?
I think
Thank
that's
you,
a great...
Andreas. And Andreas Ringman, I will let you answer, but we need to keep it fairly short because we have so many other guests as well. But go ahead.
Very good. Thank you, Anna. Now, I think that's a wonderful question, Andreas, and something that I think we've been struggling with from day one. I think there are a few simple answers, and then there are a few more complex. But some of the things is that it is a truth that the more you integrate, the better your solution works. It is still a truth, and it's very much a truth, I think, in the healthcare sector. So that is no fun, to be honest. Most of the time it's hard work, but it has to be done. So that's something we focused on very early on, to integrate to every potential system. It takes a lot of man hours to do that, but it's also very fundamental. The other part, I think, is, which I think that someone in the chat also said, when it comes to integrating and being in line with how people work, it is also a very human aspect of these things, right? It's the software goes only so far, and there I think at least sometimes we have been successful in being a coach and a partner, because if you think about it, not many people know how do you work digitally. It's not an inherent knowledge in a healthcare region because it hasn't been done before. I think there we've been able to say, we've done this 150 times before, here are a few things we learned. Why don't we start there? And then we can sort of tweak it from there. But yeah, it's a huge topic, and I think that would be a workshop in itself.
Thank you. Yes, and I realize we need to have more webinars about this. We would need 2 hours just for this question. Thank you very much. And you will stay, panelists, in the first panel. I see we have questions in the chat. I will need to move on now to our second panel, but let's bring up the questions later. So now I want to turn to Jeanette Duval and Maria, let's see, there you are, Maria Hassel from the Swedish eHealth Agency and from Karolinska. Jeanette Duval, you are the head of innovation at the Karolinska University Hospital. Warm welcome. And Jeanette, when you hear the panelists talking about their view of how to get your innovation found and possible to integrate and tested in healthcare, what are your views? And also Petra Norebach talks about the national initiatives to allow and create a national digital infrastructure allowing many innovations to be combined, so to speak. So from your view, you are at Karolinska, you're sort of a gatekeeper, you develop policies, we could say, at the organizational level for how to invite these innovations. And what are your reflections on the discussion so far?
Yeah, so I don't want to see myself as a gatekeeper because we do embrace, we want to promote the openness and actually be in contact, but it is a real struggle as there is so many different options and opportunities out there. And you talked a little bit about the tension of changing from within because it's a slow pace, and then the struggle of coming inside when you come from the outside and so on. So these are actually the type of questions that we deal with every day. And I would say that the core issue is that we need this innovation. We are dependent on them. So we want to promote it and the dialogue with the outside. But it's not really our core business. And I think that goes back to the slow pace and maybe also the openness or the awareness of the internal organization when it comes to these kind of questions. So our core business is treating patients here and now and not thinking every single minute about how different solutions and opportunities can bring us to a better care tomorrow, even if that is, of course, a huge thing that we need to tackle and think about. Yeah, so I think that since it's not our core business and we often are very reactive. So it's very, and so when you talk about my position and the group of people that we do have that works with these kind of questions full time, which is a very small number of people thinking about the large size of the organization, it is really about, okay, so how do we get less reactive and more proactive? What kind of strategies and plans and structures do we as an organization need in order to handle all these great opportunities and innovations that are out there?
Thank you. Thank you. And thank you for being honest and vulnerable and saying this is challenging. And so you're saying this is, we're not so many working with this. And so how can the innovators help you understand their innovations, and how can maybe national policymakers help you in opening up, you think? What is it you need from these external parties?
So we are working actually on communicating our internal needs, and then from these internal needs interacting with the outside. And I think Andreas Hager can talk a lot about that, as he is involved in one such initiative. So that is on the one hand. Of course, we also want to be open for what is out there, because a lot of times the great solution do come from ideas that aren't starting from the internal need as we see it. But then we would need the help of the outside organization to actually know a little bit about how we work when they reach out to us, and also understand the struggle in that. And policymakers like national, I mean, that's a huge thing for us. I think that we need to discuss the overall role of a healthcare provider or organization in the innovation ecosystem as it is, because as I said, it's today not our core business. We work a lot out of our core assignment, which is care. But I think that health organizations have and should play a huge role in driving innovation. And to do so, we really need overall national policies defining our role as such a driver, if it comes on the entire span from the health data that we have and the patients, and then the possibility to come in and test in a clinical setting, and all the way to implementation and scaling, as we're talking about now. So we should play a much bigger role, I think, than we have defined today.
Thank you. Yes, and so you are interested in allowing new innovations to come into Karolinska, in a broad sense, Karolinska and the patients in their homes, the patients you serve. So can you give an example of, if you have an example of something you've worked with lately, you don't have to name anyone, but where you have tried and sort of acted as a test bed or experimented with a new innovation in your team?
Yes, so it's the clinics that actually do the hands-on work with the different projects. I would say that there are like 3 very big areas within the hospital that we invest in, and that is precision medicine, and as you were saying, remote care, home hospitalization, and AI. So there are plenty different aspects that are tested in these very broad, big areas, and it all goes back to how we should treat our patients better with the scarce resources that we have within our system, and so on.
Yes, 3 important areas. And if we return to the issue of evidence, which I hear so much, and how can you prove that your innovation will be safe and that it will deliver value? We need to know that before we dare try testing it even. Can you say something about that in relation to one of these 3 areas that you talk about? How have you... Has it been very challenging to get this evidence, or how have you worked with it? What is needed for you to invite an innovation to these?
Yeah. It is a struggle to get the economical values there early on, because you need to test and you need to collect data and you need to analyze in order to be able to answer that question. And so it's like a chicken and an egg question, but we work with small project pilots, and then hopefully we gather enough data to show that there is a value, and then we need to interact with the different organizations and policymakers to show that we've tested this one out and the data shows this and that, and that's why we need to change if it is the economical models or reimbursement models or the way of caring. But it's a long process, and I think it starts with really testing.
Yes, and that's a nice way of looking at it, rather than saying we know how it works from the start, but let's generate data and then we can learn and tweak the innovation. And I think that's for some a mind shift in healthcare. So some argue we need new processes for vetting and approving innovations because we need to implement them at the same time as we generate evidence about their potential, so to speak. Thank you, Jeanette. And we have so many questions in the chat. Maybe we should take one, and Maria, I will soon let you in as well.
Can I just say, I'll be
Yes.
happy to take a question. And since I'm sorry that I won't be able to stay for the entire time out, so I will have to leave in a couple of minutes. But if there are many questions and you will be interested to reaching out, please do so after this webinar as well. And I'll be happy to answer any questions that you might have.
Thank you. And why don't we say thank you to you, Jeanette, and if you have a minute, you can write something in the chat, I think. So maybe
Sure.
that's a better decision, but I know you need to go. Thank you very much. Let's move on to Maria. And from the eHealth Agency's perspective, maybe you can tell us a little bit about the initiatives that you are working on right now in this area to start with, based on the previous discussion.
Well, absolutely. As you heard Petra say, we have a few assignments at our agency, quite a lot actually, regarding a national digital infrastructure for mainly health data, but also we have an assignment on creating an interoperability function. That is, I like the expression Andreas H said, behind the scenes things, you know, that things that needs to work behind the scenes should be equal for every region, every municipality. It's a sort of basic infrastructure to build upon later. That is one thing that my agency is very much involved with. And when it comes to on a European level, we have been very much involved with the preparation for the European health data space, which is something that we have talked about constantly for 2 years now, I feel like. It's the idea that we should be able to share health data, just both for us as European citizens, that we should have access to our health data when we move around in the union, and we can do that. There are 2 services in place already: the ability to have your e-prescriptions dispensed no matter where you go in the union, and also if you get ill or if you sort of plan to have healthcare somewhere else in the union, your clinician should have access to your patient summaries. That exists already, not just for us in Sweden, because we could do it for the prescriptions because we actually do have them digital, all of them, but legally we're not allowed because at the moment that is ruled by a directive and those are not applicable as is in national law. But the regulation, the European Health Data Space regulation will work as a regulation as is in every member state. The secondary use of health data, which is also covered by the proposal, is that we should use our health data together with everyone else's health data for research and for innovation, and also for us as policymakers. We need to have good data to make good decisions. So that's in short what we're working at. And there was supposed to be a preliminary decision last Thursday, but the Parliament and the Council and the Commission could not agree. So there's a new chance on Thursday. So we're waiting.
Thank you. That's really behind the scenes as well.
Yeah.
Thank you very much, Maria. And I have so many questions for you, but I see we have a question in the chat here that relates to the European data health space. So the question is, my question is related to this pre-European data health space phase that we are in. Considering the early stage of health data access bodies formation across Europe, which other alternatives could a small or medium-sized enterprise outside of the academic environment pursue to gather reliable data to train machine learning models in Sweden?
I think that's a very good question.
Yeah.
I understood the question absolutely, and I think it's a very good question. And unfortunately, I do not have an answer because I do think that's one of the issues that the regulation will try to solve. It feels like SMEs are sort of excluded from that environment in a sense. They can gather their own data if they want to and do research on that, but that's not sufficient. Probably not sufficient in every aspect. So no, I have no answer to that. What happened? What you do before the regulation comes in place? I really do not know how you do that. So good question. Not a very good answer.
Yes, but please, and I will. So thank you, the person who asked this question. I invite everyone to write answers in the chat to this question. Maybe there
Yes.
are creative ideas, and including the other panelists. Would any of the panelists like to comment on this question?
How did you
Andreas?
do it? How did you get the information? Yeah.
I can just, can you hear me?
Yes.
Yes.
It's one of the big, as Jeanette said, I mean, precision medicine AI is one of the biggest topics. So exactly that question is, and who, because there is a lot of learning by everyone here, and there is a lot of risks of learning, or risks. Everyone is perceiving risks on where value is getting stuck or siloed, and we as a hospital are thinking a lot about getting stuck with different vendors in the future around these learning models. So I think it's pinpointing something very important. And as Maria said, I don't think there are any good answers, but what we as a hospital are doing is, of course, trying to consolidate all different projects to have them on a map that are happening, and then trying to do good pilots. So that's something that Robert Svebeck, who he was here before, but he left, but he has that assignment with our hospital to try and figure that out. But it's super tricky. It's super tricky.
Yes, and again, maybe it's also a good step to take these steps and create relationships that we keep talking about. But data is not only about the technical interface, but you need to start building a relationship with someone and then agree on.
Yes, and also what you need to know, which I think is a horrible number. I read a report from the OECD. They said that 30% of all data in the world is health data, and we're using 1%. And that's such a waste of electricity and data space, really, data capability. Because if we gather all this data, why don't we use it? And there are many reasons why we don't use it. Some can be legal, some can be organizational, the lost interoperability layers. But what we are as an agency being assigned with the interoperability function, for instance, we already have the function we call joint. Let's see if I can translate it in my head to English. Joint National e-health specifications. Specifications is sort of an instruction on how to implement a standard. And there are many good examples in the country of where this has been done, and they've been done for very local reasons sometimes, but some of them are so good that you could really assess them as being interesting on a national scale. So we do that together with other stakeholders to make sure that these specifications work throughout the ecosystem. So there are things that we can do as a government agency in this landscape where the regions are autonomous and self-regulating in a sense. So we can support them and guide them if possible, but not really regulate in a sense. But the European Health Data Space regulation will change that in a way, because traditionally healthcare has been what's called a national interest topic within the union, and in our country it's a regional topic. But this is the first time, except during the pandemic, that we really have a regulation in the healthcare sector. So that's going to be very interesting and good, hopefully, but also interesting. Yeah.
Yes, thank you, and the panelists, feel free to raise your hand as well and pose questions or requests to Maria as well. Something I hear a lot is that there are so many different agencies and so many different regulations tied to healthcare. So who should I turn to? Are there what is your advice there, Maria, for a startup who wants to understand what's required of me to get in somehow?
Yes, I do understand, and I agree. There are so many laws and regulations, and the regulations on a level that sometimes it regulations on what you should do, but not how to do it, and that's even more trickier, because then you come up with an idea of how to do something, and you want to make sure that you do it within the legal right framework and so forth. I haven't, again, not very good advice, but I would contact one of the agencies and start there. There are good helps to have. We had with the I should have looked up their names before EMI, the privacy agency, personal privacy agency, which that's not called in English. The EMI, you know which agency I talk about? Integritetsskyddsmyndigheten. So they are actually quite helpful. So if you start there, that's good. But I can I can give you a good example in another country, which I think we should really copy, and that's in France. They have something called Genius, which is a sort of one-stop shop for all the information you need as a startup. What kind of funding can I get for my project? Where can I seek support, and where can I seek sort of legal guidance and so forth? So that wasn't even an answer either, but I think it's a good example of how you could do it. Yes, but we do not have that. There's not one agency that has that combined responsibility for this sector.
No, but that's a good example, and I know there are many initiatives going on now. So maybe if you're listening, the people engaged in these national initiatives, you can listen. And I also think it's
because
difficult.
there are but there are, like Vinnova, for instance, the Agency for Innovation is a good contact point. So there are good agencies, but we are working a bit in silos to be a bit critical of the agency system, but we will have our very specific mission and instruction of what we should do and must do and so forth.
Yes, and maybe so something for you to think about is making that clear on your websites. This is what we do. We don't do this. This is what they do, for instance.
Absolutely.
And in the panelists, among the panelists, do you have any advice in this regarding how to understand the regulations, where to start? How have you worked with that as a digital innovator? How do you know that you comply with the regulations that exists? Anna-Karin, what do you say?
I think I know what we would do differently today than when we started, if I was to start all over again. And I think that when you work in the medtech space, to whether your product will be like an MDR classed product under the Medical Device Directive or not, I think you benefit as a company, and your customers will benefit a whole lot from you starting to get the necessary, like the bigger ISO certifications. Like to start that process day one will be much easier than starting it later. And the major certifications I would say in our space would be the ISO 13485, that's the quality management system for medtech products, and the ISO 27001, which is the information security standard. If you have those two in place, then you will be all set to get whatever other certifications you need, or to be well prepared for like the MDR. Then it depends on whether you could place your product on the market before having MDR or not, and that's of course product specific. But a strong recommendation is to start preparing for your ISO certifications from day one. Then there is, just to add to that, there is a Nordic initiative that we welcome a lot, which is called NordDEC, which is a quality assurance of health tech apps, where our company is the first to be certified, and I think that others are in the process. And that's the Nordic ministry, the Council of Ministers that have initiated that work to get the quality assurance in the Nordic countries, and we welcome that initiative. So that's another tip from us. Thank you.
Thank you. Thanks a lot. Sofia?
From within, I think you need to push your legal experts within the region or the hospital, and also the technology departments, in order to have them more alert that healthcare is actually changing all the time. So they need to scale up in and also understand innovation in a much more deep way. Because they are the experts, and also to have this in place and to bring them on early, I would say also, and discuss with them without and still have the need of the patients and the healthcare professionals in mind always, but take the legal on board much earlier, I think.
Thank you, Sophia.
Can I say something about
Yes.
about the first panel, which I thought was so very nice? All of you said that your innovations always looked at the problem, to find a solution to a problem or fulfill a need, and I think that's, yes, legal and interoperable standards. So, but if aside, if you do not have a good idea that will fill a need or solve a problem, then you should not be, you should not be doing that, because I've seen so many examples of a very good product or a very good idea that doesn't solve anything. So that's also something to think about. Sorry,
Yes.
that was just something that popped up.
And I agree, and that sounds like it's self-evident. You need to have a problem,
but
but
it's
we
not.
see that so much as well at SSC. The technology push. We can
Yeah.
optimize this. Well,
Yeah.
why?
No one asked you to. Yes.
Exactly. So that's a good advice to give. Andreas.
I think that this connects to something Andreas said, something Anna-Karin said, and something Sophia said. And I think it's about being clear about what you're trying to develop and create a way to communicate that so that people can understand it. So that the ISO standard is a very good way of starting to kind of express things so that regulatory people can understand what you're trying to do. And Sophia is saying, talk to the internal people. And that's the thing, they are your judges in the beginning. So it doesn't matter if you go to court, if you would be right, or if you went to EMU, you would be right. The people at the hospital, the lawyers there, they're the ones who decide. So kind of to be smart in the way we communicate what we're trying to do, and to be smart in expressing what we want to try to do today, like Andrea said, starting with something that has some word today. So in our case, it was there are things called patient support systems, or there are things called healthcare administration, whatever. Then you can look at ways those have been described before. You can so that's it's a lot about communication. And as a lawyer, we always say det är skillnad på ha rätt och få rätt. That's something you know. There's always risk, and kind of just being exactly what the law says is not what reality tells you. So find smart ways to communicate. And in my case, I did the MDR by working a lot with the user, the customer journey maps. So kind of service design combined with ISO frameworks. That's a very hands-on way to then you can go to a lawyer, say, this is the customer journey we're envisaging. It involves the patients this way, the clinics this way. And then we have been looking at ISO, and we think, I mean, these are, of course, important aspects for your patient safety, information safety, procurement, whatever. Yeah.
Yes, very good. Some kind of map or sense-making device that you can depart from when you talk to people, exactly like the patient journey map.
A map that everyone understands, yeah.
Yeah. Thank you. And Andreas Ringman-Uggla, I want to invite you as well to give some sort of advice if you want, or a request if you have a wish that you want to express at the end of this seminar, which is coming to its end, actually.
No, I actually put down my hand because I think that the rest of the speakers said it really, really well. So thank you so much for arranging this.
Thank you. And I see that we need to stop. Yes, time's up. Maybe you have other assignments to work on, but I see many comments in the chat. I will have a look at them and maybe send them to the panelists, and we can see if we can send out some reflections based on the comments. Thank you very, very much for joining today, and hope to see you again.